the MAN TV.
Hello everyone. Here is an announcement. MAN TV is bringing you something really helpful for you. Your exam is coming near and of course you need good marks to prove you are a brilliant student, but course is in too much length and time is too much short. This video is the solution. So let's start. Down syndrome. Down syndrome is a genetic condition where a person is born with an extra copy of chromosome 21. This means that they have a total of 47 chromosomes instead of 46. This can affect how their brain and body develop. Symptoms of Down syndrome. Physical symptoms, cognitive symptoms, behavioral symptoms. Physical symptoms: a flat nose bridge, slanted eyes that point upward, a short neck, small ears, hands and feet, weak muscle tone at birth. Small pinky finger that points inward towards the thumb, one crease in the palm of their hand, palmar crease, shorter than average height. Cognitive symptoms: problems in walk and move, gross and fine motor skills, speak, language development skills, learn, cognitive skills. Behavioral symptoms: stubbornness and tantrums, difficulty paying attention, obsessive or compulsive behaviors. Causes: there are 3 types of Down syndrome with different causes, including trisomy 21, translocation, mosaicism. Trisomy 21. The term trisomy means having an extra copy of a chromosome. Trisomy 21 occurs when a developing fetus has 3 copies of chromosome 21 in every cell instead of the typical 2 copies. This type makes up 95% of all cases of Down syndrome. Translocation. Unlike trisomy 21, translocation occurs when chromosome 21 isn't separate, but it relocates to another numbered chromosome. This type of Down syndrome accounts for less than 4% of all cases. Mosaicism occurs when only some cells contain the usual 46 chromosomes and some cells contain 47. The extra chromosome in some cells is chromosome 21. Mosaic. 1% of all cases. Tests. Prenatal. Blood test. Screening tests could be a blood test of the birthing parent's blood to look for indicators of Down syndrome. Ultrasound. Another screening test is an ultrasound. During this imaging test, your provider will look for signs of Down syndrome, like extra fluid behind your baby's neck. During pregnancy, tests could include amniocentesis, chorionic villus sampling, CVS, percutaneous umbilical blood sampling, PUBS. These tests can detect chromosomal changes that lead to a Down syndrome diagnosis. Treatment options could include physical or occupational therapy, speech therapy, participating in special education, treating any underlying medical conditions, wearing glasses for vision problems or assisted hearing devices for hearing loss. Torticollis. Torticollis occurs when your baby's neck muscles cause their head to turn persistently and rotate to one side. It's also called wryneck. It can be congenital or acquired. Symptoms: limited movement of your baby's head and neck. One of your baby's shoulders is higher than the other. Neck muscle tightness or stiffness. Swollen neck muscles. Small pea-sized lump in one of your baby's neck muscles. Uneven, asymmetrical, facial features. Gastroesophageal reflux, GERD. Vision problems. Reaction to certain medications. Arthritis of the neck, cervical spondylosis. Severe neck pain. Head tremors. Headaches. Causes. Researchers aren't sure why one of these muscles shortens in some babies. It may be due to the way your baby was positioned in your womb, uterus, an abnormal development in the SCM. Scar tissue. Sandifer syndrome, a rare condition that combines GERD with neck spasms. Greisel's syndrome, a rare complication of head and neck infections or ear, nose and throat, and surgeries. Test. Depending on the severity of the condition, your baby's healthcare provider may order tests including neck X-ray, head and neck computed tomography, CT scan, head and neck magnetic resonance imaging, MRI scan.
Treatment. Stretching exercises and position changes can treat congenital torticollis. You'll want to practice torticollis stretches several times a day. Your baby's healthcare provider will teach you how to stretch your baby's neck muscles. You'll need to gently move your baby's head to the opposite side.
Erb's palsy. Erb's palsy is muscle weakness in the arm or shoulder that can occur as a result of a certain type of injury to the brachial plexus, injury sustained during birth or later in life. Brachial plexus birth palsy, in newborns. Erb's palsy occurs nearly 12,000 cases per year. It's most common in larger infants who need to be pulled out during delivery because they're stuck.
Signs and symptoms. Paralysis or limpness of the shoulder, arm and elbow. You can't lift your limb. Numbness or tingling in your arm or hand. These are also known as burners and stingers. Asterisk a hand position known as the waiter's tip position.
Causes. Erb's palsy, brachial plexus injuries, in adults. Traffic accidents, gunshot or knife wounds, industrial accidents. Accidents related to contact sports like football, surgical complications or tumors. Test. Your healthcare provider might also order these tests. EMG, electromyography. This test finds out how well muscles and nerves work. Imaging tests. These tests take pictures of what's happening inside your body. Your provider may order an MRI or a CT combined with myelogram. Your provider might also order an X-ray if there is any question about broken bones.
Treatment. Treatment of Erb's palsy depends partly on how severe the injury is. Some cases resolve by themselves within 3 to 4 months. But, most likely, your healthcare provider will suggest that you do exercises and physical therapy with your baby from about the age of 3 weeks. Spina Bifida occulata. A congenital defect of the spine in which part of the spinal cord and its meninges are exposed through a gap in the backbone, often causing paralysis of lower limbs. Meningocele. A meningocele is a birth defect where there is a sac protruding from the spinal column. The sac includes spinal fluid, but does not contain neural tissue. It may be covered with skin or with meninges. Myelomeningocele. A defect of the backbone, spine, and spinal cord. Before birth, the baby's spine, the spinal cord and the spinal canal do not form or close normally. A myelomeningocele is the most serious form of spina bifida.
Symptoms: bladder and bowel problems, sexual dysfunction, weakness and loss of sensation below the defect. Inability to move the lower legs, paralysis, and other cognitive impairments. Orthopedic malformations such as club feet or problems of the knees or hips. Causes. The exact cause of the occurrence of spina bifida isn't clear. Lack of folic acid, a combination of genetics and environmental factors, is thought to be the main cause. Not having enough folic acid during pregnancy is one of the most important factors that can increase your chances of having a child with spina bifida. Prognosis and tests. These tests include a blood test, taken during the 16th to 18th week of pregnancy. This screening tests the amount of AFP, alpha-fetoprotein, in the blood. The amount is higher in about 75% to 80% in women who carry a fetus with spina bifida. An ultrasound, sonogram. Problems with the fetus's spine may be spotted through imaging. Amniocentesis. Fluid from the uterus is removed through a tube to test for protein levels. Treatment. During childbearing years, women should take a vitamin with 400 mcg, 0.4 mg, folic acid every day. Some studies suggest that if women take this dosage of folic acid, the incidence of spina bifida could be reduced by up to 75%.